Larry, come over here for a minute.
I know Larry understands how important MedRec is.
He's a good nurse. He's so compassionate and takes such good care of our patients. But he just seems to have a hard time speaking up to Dr. Salib.
I think that Larry should try to use the CUS tool from the TeamSTEPPS program we've been using. I think it would benefit him and Dr. Salib when something like this is happening.
Yeah, definitely.
I mean, there's nothing to tell me here, so...
It's almost time for our break. I'm going to talk with him about it.
I think that's a great idea.
Larry, I overheard Dr. Salib's concerns about MedRec with Mr. Lee. I got the sense that you wanted to say something and wondered what you were trying to tell him.
You know, I wanted to tell him it's important for the nurses to help out with MedRec. Dr. Salib's really busy, and sometimes he may make assumptions which could lead to errors.
Did something happen?
Last week he changed Miss Matthews' blood thinners. When I did a teach back, she told me she was planning on taking 2.5 pills. That would have been way too much. When I asked Dr. Salib about it, he said he told her the right dose, and he wrote it down, and he didn't know how she didn't get it right. I want him to know I'm not questioning his authority, but I also want to make sure there's clear communication to the patient so they don't take the wrong medication or the wrong dose.
Dr. Salib's an excellent provider, but he can also be really intimidating.
So what should I do? I want to make the MedRec process better.
Before we can even begin thinking about revising processes, we need to work on being able to speak up. The CUS tool from TeamSTEPPS is simple to follow and remember. Sometimes I feel like cussing when I deal with some of the attitudes around here. It's literally CUS. I'm concerned, I'm uncomfortable, and this is a safety issue.
Yeah, I remember that tool.
So what were you concerned about with Dr. Salib, Larry?
I was concerned about him doing the MedRec by himself. The risk for error is high when someone's as busy as he is.
Okay, so the next time he tells you that he doesn't need your help with MedRec, what will you do?
I'll tell him I'm uncomfortable because the MedRec procedure shouldn't be rushed by anyone.
And what will you do if he still won't listen to you?
I'll tell him that it's a safety issue for patients, especially for someone like Mr. Carter who's coming in this afternoon. I already know he's on a blood thinner.
So it sounds to me like you're ready for your next conversation with Dr. Salib.
I hope so. Hey, thanks for taking the time to help me through with this. And for not lecturing me on the right or wrong way of doing it.